Hey there, viewers! What your skin says about your health. Don't ignore these. The skin is the window to a person's health. After all, it's the largest organ of the body, so it's bound to tell you some things about what's going on inside your body. Just as healthy skin contributes to your overall health, one primary ability of the skin is also to raise the red flag when your body is sick. The skin does this by displaying abnormal changes in texture, color, itching, and other characteristics and sensations. More importantly, many of these skin symptoms actually indicate underlying health problems that shouldn't be ignored. For instance, a butterfly rash on your face that just won't go away can mean you have lupus, and nobody ignores lupus. So, do we have your attention now? Let's take a closer look at these skin signs and what they might indicate for your health. Number 1. Velvet plaques. Velvet plaques are dark, velvety discolorations in the folds and creases of the body. It usually affects the neck, groin, and armpits. If you have these in those areas, it can indicate diabetes. This skin condition is called Acanthosis Nigricans and could be benign or caused by obesity. But more often than not, it's one of the early signs of diabetes. Children who have this condition are at a greater risk of developing type 2 diabetes. Albeit rare, Acanthosis nigricans can be a warning sign of a cancerous tumor in an internal organ such as the liver or stomach. Before we move on, a like would be awesome. Number 2. Red scaly patches on the scalp. Most people have had mild dandruff that typically shows up when the air is dry. However, red, scaly, and itchy patches are another story. If you have them, then it's a classic sign of psoriasis, a condition where the skin cells replicate too quickly without properly shedding. Psoriasis can appear anywhere on the skin, but the most common is on the scalp. Aside from the burning feeling or soreness, psoriasis can lead to hair loss. Unfortunately, it doesn't usually get better on its own, so seeing a dermatologist is important. Number 3. Butterfly rash. A butterfly rash spreads across the cheeks and resembles a sunburn. A rash on the face isn't always lupus. However, if you or anyone you know has a purple rash near the hairline and has little patches of hair loss, then it's likely lupus. Lupus is an autoimmune disease that causes inflammation in tissues or organs. Aside from affecting the skin, lupus can severely impact major parts and organs such as hearts, lungs, kidneys, muscles, blood, and joints. Lupus is known to have 1,000 faces, because each case presents itself differently. Number 4. Tripe palms. Having thickened velvety palms with pronounced folds in the lines of your hands is a skin condition called tripe palms. It's a very rare skin disease. But when it happens, 90% of the time, it's a sign of cancer. There's no specific treatment for tripe palms. In fact, approximately only 30% of cases resolve after the cancer is treated. In many cases, it stays unresponsive to successful therapy and may persist for years even when a person is in remission. Number 5. Yellowing skin. Jaundice is characterized by the yellowing of the skin, usually accompanied by the yellowing of the whites in the eyes. In adults, it's most commonly associated with hepatitis, thalassemia, and even pancreatic cancer. Hepatitis is a virus-caused disease affecting the liver. It can also be a result of constant medications, drugs, and alcohol. Thalassemia is a hereditary blood disorder where blood cells are destroyed. Lastly, pancreatic cancer, like its name, affects the pancreas. So if your skin or the whites of your eyes have turned yellow, consult your doctor as soon as you can. Speaking of hepatitis, another possible sign of this condition is having itchy violet bumps on your wrist. It's called Lichen planus, which we'll talk about next. Number 6. Itchy violet bumps on the wrist. Lichen planus is a rash that appears as flat-topped bumps in color reddish-purple. They may also be very itchy. In most cases, they occur on the wrists or ankles, but can also be in the mouth, lower back, neck, legs, and genitals. There hasn't been a known cause for this one, but if you do have it, you should get some liver tests. Lichen planus is associated with a viral disease like hepatitis C. Number 7. Unusual hair growth. Do you have unwanted hair appearing in classic male areas like the chin or below the belly button? Well, it can be a sign of polycystic ovarian syndrome or PCOS. It is also important to note that hair growth is also influenced by genetics and hormones. But if you're worried or experiencing other PCOS symptoms such as irregular periods or inability to lose weight, then better consult a doctor. Unusual hair growth is one thing, but excess fine white hairs are a completely different story. Next up, let's learn about the potential health risks of this skin symptom. Number 8. Excess fine white hairs. We all know that skin cancer shows up on the epidermis. What many aren't aware of is that internal cancers such as lung, ovarian, or gastrointestinal can have skin symptoms as well. A person who develops excess fine white hair is suffering from a condition called Hypertrichosis Lanuginosa. They typically appear on the face. It may not seem like a big deal, but Hypertrichosis Lanuginosa is an ominous sign of internal malignancy that's most commonly linked with colon and lung cancers. Number 9. Random or changing moles. When it comes to serious skin problems, skin cancer is the first disease that comes to mind. Indeed, it's a life-threatening condition, but it's often successfully treated if caught in the early stages. Skin cancer isn't always obvious, but you should consider talking to your doctor if you notice any of the following. A mole that's asymmetrical, has changed size, shape, has an irregular border, has changed color, or is larger than a pea. An itchy or painful lesion, a flat, crusty lesion, an irregularly shaped lesion that's color red, brown, white, or black. Number 10. Unexplained tanning or darkening of the skin. When a person becomes 2 shades darker despite staying indoors most of the time or during the winter season, then it can be a telltale sign of Addison's disease. The darkening can also be seen in the gums or inner ear. It's a chronic disease caused by a damaged adrenal cortex, leading to a shortage of cortisol and aldosterone in the body. Consequently, the brain overproduces the hormone ACTH, which increases skin pigmentation, hence the sudden skin darkening. Okay, here's a scenario. You've had chickenpox as a child, but now that you're an adult, you're having chickenpox-like rashes. Those are most likely shingles. Here's what you need to know about it. Number 11. Painful rash on one side of the face or body. A painful rash or blisters can signal shingles. It's a viral infection that's brought by the reactivation of the varicella zoster virus, the same virus that gave you chickenpox as a kid. The virus always remains in the body after the physical signs of chickenpox fade away, and sometimes it can reactivate in adulthood. Shingles can be dangerous when left untreated for a while, and especially when it comes back after middle age. Aside from lasting pain, it can cause significant complications such as loss of vision, hearing, or balance. Number 12. Visible veins. Feeling conscious of your visible veins? Well, you may have more than a cosmetic concern to worry about now. Visible veins can help you determine your circulatory health. For example, spider veins or varicose veins on your legs are often an indication of a far more serious condition about your blood flow. Luckily, you can avoid this condition with regular exercise, a healthy weight, and avoid sitting with your legs crossed. As for the unsightly veins in the face, they can be a symptom of rosacea or excessive straining. Learn more about rosacea here. Number 13. Persistent facial redness. Does the central part of your face always look red and feel hot and tender? That may be rosacea. It's a skin condition that's common among fair-skinned middle-aged women, though it can appear to anyone at any age. Rosacea is often mistaken for acne, but it isn't, so it won't respond to acne medications. Unfortunately, there's no cure for rosacea. You can only manage it with medications and some lifestyle changes. But the good news is that it's not dangerous. Nevertheless, it's something you shouldn't ignore unless, of course, you're okay with walking around with a red face and visible spider veins. Do you have any of those skin symptoms? If yes, then speak to your doctor as soon as you can, especially if it can indicate something serious. Don't hesitate to share your thoughts about this video below. If you liked the video, give it a thumbs up. For more interesting facts on the human body, subscribe to the channel. Here are 2 more videos you should check out. Both of them will definitely help you reach your goals.